What's up guys, Dr. Gary here. I want to talk about why men should almost never lower their hairline. And so this is an interesting topic. If you go to my website, you'll see a surgical hairline lowering example on a male patient, and people, they keep contacting us and asking like, oh, can I get my hairline lowered? And there are very few cases where that is a good idea. And let me explain why. In male pattern hair loss, which is the most common type of hair loss that men suffer from, there is a progressive recession of the hairline back, and there is something called the Norwood-Hamilton classification system you guys may have heard of, so we'll flash that on the screen. But the concept is that this whole area just starts to recede back, the corners go first, and you get this area in the center left, and then that can recede back further, and then the crown, of course, as you guys know, and then usually there's like a little band left here between the mid-scalp and the crown, and then that can also go in some patients. And so that's the kind of natural sort of progression. So if you take someone at a young age, let's say 20 years old, who is starting to recede, or an example of someone who just naturally, a lot of guys contact me, young guys, they say naturally I just have a high hairline, and that's possible, right? Some women have high hairlines, some guys have high hairlines to begin. So whether you're receding or you're starting at a high hairline but you're young, there's a problem with doing a hair transplant or surgical hairline advancement where you're bringing that hair down lower. And the reason is because of this whole potential progressive male pattern hair loss that many guys will get. And at a young age, whether it started or whether it hasn't started yet, you just don't know the long-term sort of result and the eventual appearance of the person's hair over time. So if you take someone who's very young and at high risk for thinning and receding, and you transplant them too low, or you do a surgical hairline lowering surgery, now you get hair down here and or a scar down here. Now imagine over time, as you start to recede back, now you're going to have a super visible scar that's going to be very hard to chase with grafts, and you'll have grafts down here but loss of hair further back, and ultimately you'll run out of donor supply to fill in that whole area. Some people think, oh, okay, I'll get the transplant here, we'll bring down my hairline by an inch, and later on, if I thin out more, we'll just do another hair transplant. Well, yeah, you can do more hair transplants, but you'll never be able to cover everything, especially if you are one of the unlucky ones that, you know, is maybe prone to a Norwood 7. You will run out of donor supply. Even if you start asking me for neck hair and chest and back hair and all these things, it will still not be a good idea to try to fill this whole region, because it's a lot of area to fill. So if you start too low, you won't have enough hair in the donor supply to cover all of this over time. And that's the main reason to not lower the hairline at a young age. Now, if someone's much older, someone's in their, say, mid-30s, late 30s, 40s, and they have a high hairline and they just are sick of it, as a guy, I'm talking about men here because it's a little bit of a gender-specific type of situation. If that's what's going on, if they're older, then you can at least discuss potentially bringing them down to some degree, again, within reason. And so some people say, well, okay, well, let's say we can't fill all the way back, but I still want the hairline down here. But the problem is it doesn't look very natural when you have a hairline that's starting where it normally, you know, is when you're 18 years old, but you're missing your entire crown. To any layperson who doesn't, you know, necessarily know anything about transplants, but just like anyone walking down the street or having a conversation with you, they're going to know that something's not right.
Wait a minute. Who are you?
So you had this transplant when you were 20, now you're 35, all of this is thinning, your crown is starting to expand, but you've got really good density right here. It doesn't look good. It looks very fake, and it's just an overall kind of bad aesthetic to have. So the question then becomes, well, what can you do? Can you lower the hairline at all in a younger male patient? And there's no clear answer on this, right? Can you do any type of procedure? Yeah, I mean, you can do something. Should you? I think the better answer would be to just put someone on medical therapy and kind of ride things out for a number of years. But the only area where, you know, I'm a little bit lenient is sometimes when the sides start to really go, and someone wants not everything lowered, right, and not the center brought down by an inch or something unreasonable, but where the sides, you know, if the request is to just bring the sides down a little bit by, say, 1 centimeter or so, and just strengthen that, that's something that I'll consider, because those hairs can still be with that person for many years to come. them. And I'm always thinking about sort of the long-term result, not just, will you look good for the next few years, but what is it going to look like in 20 years? This is like a permanent change, right? This is real surgery with hair transplants. So this is the type of situation that comes up a lot. So I wanted to kind of get that out there. And I'm going to be referring a lot of my patients who, or people reaching out with questions about this, they're going to be referred to this video specifically, and hopefully find it useful to be, perfectly frank about what's possible, what's not possible. You can physically do the surgery, and there are people who are willing to pay me to do the surgery, but you have to have certain ethics in this specialty, and there are certain things I just won't do. Surgical hairline advancement on anyone younger than 30, 35 in a male situation is really completely off the table, and you have to be even still very careful in male patients in general with the surgical hairline advancement, because then you get a scar right here, and as things recede, you can imagine if that scar becomes more visible, it's not great. And then for hairline lowering, as I said, just to summarize, I will never bring the hairline down in any considerable way on a younger male patient. The only thing I'll consider is some frontal temporal work on the sides here where it peaks, and if someone is much older, then we can discuss options, but most older men aren't interested in bringing their entire hairline down. That's usually a request of someone who's in their early 20s, who's starting to see the impact of male pattern hair loss, and they just need to be super careful, and they need to be properly counseled. Hopefully you guys found that useful. Make sure to check out our entire hair transplant series that we have on YouTube. You can go to my website too to look at photos, email us with questions, info@cityfp.com. Keep in mind that I will oftentimes push people towards a consultation, because for me to sit with you one-on-one and talk things through, it's my time, we charge for it. But if you have any quick questions, the best way is honestly to put them up on YouTube, because I'm more likely to reply there than sometimes even through email. But if you wanted to send us a HIPAA protected photo to info@cityfp.com, we can give you at least some basic initial advice, but you really need a consultation to talk through your goals, to talk through what's possible, what I can do for you, or really with any surgeon that you choose. But having that extensive conversation is super important. You don't want to just go to some place that's going to give you whatever you want for the cheapest price possible. It's just not a good idea. These are real surgeries with real implications, and they have to be taken seriously. All right, guys, usually I don't get up here and preach so much, but I really just want to protect our younger male patients looking for hair transplants, and I want them to get the right type of work done. All right, guys, we'll see you.